Hi, my name is Sherry, and this is my family story. I have a 14-year-old daughter who needed a heart transplant. Chloe was born with a heart defect, and she had open heart surgery when she was 10 months, and then she needed a pacemaker installed when she was 17 months. Chloe got her heart transplant in August of 2022, and immediately there was some indication that there might be problems. So the heart transplant team here has 4 main doctors. The doctors conference every week about all of their patients. The team works very well to present a united front about how they feel about her care. We never get different answers from different doctors. Since Chloe's 14, even when she got her first transplant when she was 12, she was included in the decision-making process. She's gonna be the one who has to take care of her heart. Her team, all along the process, makes sure that she is on board with what's going on. Not only that, she is really a very good advocate for herself when she advocates for herself. Her team acknowledges that they appreciate that she's able to do that. When it was time to decide she needed a new transplant, her team felt confident that her heart was not going to recover and she was going to require a second transplant. I think that the doctors would have liked to list her right away for a new heart transplant, but we'd been away from home for over 6 months, and as a family, we needed time together at home. So as difficult as it was to make a decision to maybe not take the doctor's advice, we decided that it was more important for her to be home for a little while with her family and surrounded by the things that she loved, to take a break from the stress of constantly getting medical treatment and medical advice. The team did everything they could to make sure that she was supported medically while we were going to be away from them. They have a good relationship with our local cardiologist. So we've been gone since March. We come back once a month, and they ask, are you ready to start the process to get approved for a transplant? And she says, let's wait. Or we say, we kind of, we talk about it ourselves. And so this time when she was asked, she said, I think it's time for us to go ahead and start getting authorized, getting approved to get a heart transplant. Although Chloe's had a great experience here, we have had relatives that have not had that same experience. They have an infant son who had a lot of complications, and they didn't feel like they had a unified team to tell them the best way forward. They didn't feel like their family was included in the decision-making. Their experience was not near as good as ours. Given the good experience that we've had here, we definitely would advocate for a more holistic approach to treatment to make sure that, like Chloe's team, all of different specialties are coordinating through a single voice to explain to families what's going on and give families options to make choices based on what the family needs, what the child needs, what the medical needs are, what the financial needs are, that everything is taken into account. And family engagement means to me that Chloe's medical team gives us the best possible medical advice and then gives us time to make a decision about what we want to do as a family. They know that not just medically, but socially, emotionally, family unit-wise, we need those considerations to be maybe not as important as the particular medical decision, but as that they're very important for Chloe's overall well-being.
I'd like to now invite to the stage here our family engagement panel. Dr. Jennifer Brinton, who is a physician for the South Davis Community Hospital and a hospitalist at Primary Children's. Brittney Moss, who is a licensed clinical social worker with Primary Children's Hospital Rainbow Kids Palliative Care team. And Eileen Parker, a parent advocate of a pediatric patient. So please welcome everybody. Come up on stage. All right. I can see by the slides, Dr. Brinton, it looks like you are first.
All right. I won't be using the slides per se, but just wanted to give an overview of what we do and how we have found that family engagement can help us improve outcomes for our most complex kids. I'm part of the complex care division at the University of Utah Department of Pediatrics, and we work with the kids who are about 1% of the child population, but make up about 30% of the medical cost. These are kids with typically 3 or more subspecialists who have to follow them, and they are typically technology dependent, whether that's to eat, move, or breathe, or all of those things. Our team has had a specific goal to carve out both outpatient and inpatient and step-down support for these kids for the last 15 years or so. And in that time period, as we've looked at the data, we've had some wonderful results from this. I'm working with families as Dr. Ferguson had talked about, and as Rebecca Peterson talked about, helping families know what they need to do with their children can help them stay out of the hospital, can help them get care that they need early on so they don't escalate in their needs. And the data we've shown from that has shown about a 69% decrease in hospital costs for the kids in our program, about a 40% decrease in length of stay for hospitalized children with trach vent dependence, which are some of our most complex of those complex kids, as well as decreased emergency room visits and decreased complication rates as well. We cover a complex care on-call service 24/7, and often get families or their home nurses calling in when they have questions or concerns. And I would never want to have the hubris of thinking that I know these kids better than the parents do, because that is never ever the case. We are grateful that these parents are the experts for their children, and we want to help them be the experts. So, as I mentioned at the last panel, often when you see a problem, it can make you really sad and depressed, but also can give you a chance to focus a solution and target a solution. So when we see problems of families getting access to home nursing, or getting access to DME equipment, or being able to get their children into into the school setting, or whatever the barriers are, we can work with teams. We've worked to help craft some of the waiver language and trying to advocate for increased waiver support, so families can have that support at home and kids can be in the home setting. We help support kids to get out of an ICU earlier. A study just released this year looking at 4,000 kids who were trach vent dependent found that 75% of the hospital beds and ICUs are made up of those kids, but a large portion don't meet ICU care otherwise. They have a reason they're stuck in the ICU. Maybe they can't get parent training. Maybe there's not home nursing. Maybe there's not DME support for their equipment. Maybe they can move to an inpatient service like we do at primaries for our non-ICU vented kids, or we also have a program where we can take ICU vented babies who are otherwise stable but not big enough for a home vent out of an ICU to the LTAC setting where they can have more family time. It was great a couple months ago. I wish I could get a picture of this, but of course, with PHI, we had a little guy who'd been in the hospital for a while, and he's getting close to going home, and his 7-year-old sister came. She's like, "Okay, it's reading time." Pulled out the book, sat next to him in the crib, and was reading to him while he's on his ventilator. She can do that in the LTAC setting, whereas she might not be able to do that in an ICU setting where he'd otherwise be. So our goal, again, working with families, helping these kids get to where they need to go, and trying to be those family advocates, be part of that family engagement. That's how we make complex care better. And we're so grateful for the many parents who've helped us craft a better program with their feedback too.
Thank you. Thank you. Eileen.
My name is Eileen Parker. I'm so glad that some of you guys have spoken because I related so much, especially to you parents. Thank you for going first. So my husband is Benjamin Parker. I have 3 children, Rosalie, who is 14 now, Micah, who's 11, and Charlotte, who is 8. We love to be outdoors as a family. Since they were young, we always loved to find playgrounds and go camping and hiking and biking and all of that. And that started to change in December 2019 when my husband was turning into our driveway and didn't see an oncoming car. So he and my daughter were rushed to the hospital. My husband was doing okay, and my daughter started to have complications, and through those, she became septic. So a few days later, she coded, and we thought we were going to lose her. So why does this involve family engagement, and why is that important in this case? For all the reasons that were mentioned today. And for us, it was a scaffolding that helped her to live, to survive in the end, and to have a reason to live. She was able to get the support that held her together, that gave her the comfort and the morale that she needed and the attitude that was going to get her through these hard things. She, in the end, did survive, but she lost all 4 of her limbs. So she is a quad amputee. And that family engagement helped with the healing that was able to ensue with that. It was incredible that the medical professions pulled us into every meeting. There was a child specialist that became to know us and know our other children. And then in the end, it was the Ronald McDonald House who kept us together. I was not sure how we were going to keep all of our children so close, as we weren't sure if she'd make it home or when she'd make it home. And through that team effort, they were able to not only involve us, but my other kids as well. You can see the smile on her face as she's starting to become with healing. They weren't always able to be there, but when they walked in the room, her personality changed. She went from, I'm sad and I don't know what to do, and where's my arms and legs, and how am I going to do life, to, hey, my brother and sister are here. I can jump on the bed now. And they would giggle. They would sit on the bed together and they would giggle, and that healing that comes from that is such a great support to our patients and involves them in such a way that just helps them in their healing. We loved the nurses and we had a great thing going because we'd ask Rose, who do you want to help us? So I helped with a lot of the wound care. I'd help pull things out. I'd pull out the nose tube. They brushed her teeth. Like, okay, I can do that, but I can't brush her teeth. And so they would involve us in that. It's like, what's this going to look like when we get home? And they would show us these things. And so now I'm happy to say, because of that involvement, we knew how to take care of her, and we did so well. And I don't know how this thing works, but we love the beach now, and we go surfing and riding, and we do horses, and you name it, we do it, rock climbing. So but it all started with the engagement that we were able to have and the support system, thanks to our good friends here.
Hi, everyone. It's a pleasure to be here today. It's been such an inspirational day hearing from everyone and all their different perspectives of how we can best support families here and meet their needs. Like Orly said, I'm a social worker at Primary Children's. I've been there for the bulk of my career since 2011. I've worked in several of the units. On the floor, I was in the newborn ICU for several years, and then I had the pleasure of joining the palliative care team about a year ago. And it's been such an incredible experience to work with these families. And I think one of the things that I love most about being a social worker and also in this role is the time and the relationship that I get to spend with families. I feel like our average initial meeting with a family is typically at least an hour, as we can spend some time getting to know them, really trying to truly understand their hopes and their worries, what's important to them as a family. I feel like so often goals of cares come out of what they're interested in, what they're passionate in, what they enjoy doing as a family, all those outdoor activities, being able to kind of explore how those things can be possible with a medically complex child, or if they feel for them that it's not possible. I feel like a family's quality of life for their child is so personal and so subjective. And so we really are working to meet them wherever they're at to kind of design what they feel like they need for their child and their family as a whole. Of course, as we're meeting with them and building that relationship, always using our skills of active listening, reflective listening, responding to their emotions. And then I think part of my role as a social worker and also part of this team, I feel like is a bridge, kind of all the things we were talking about. It's a bridge to the different community resources that they might need. I've sat down with lots of families doing Medicaid applications and waiver applications, guiding them to Social Security, all those fun things that we talked about that are so intimidating and overwhelming for the majority of people to navigate and make sense of what is really being asked of them on that application, or getting them a list of different support groups, connecting them with a peer mentor, seeing if it makes sense for me to start meeting with them to provide some therapy, or we also have another clinical mental health counselor on our team that provides therapy, or if it makes sense to connect them with therapy for someone in the community, finding telehealth resources for therapy for those who may live in an area where it's harder to access that a little bit closer to home, and navigating here's who's network with your insurance, here's who's possible to actually meet your needs in a way that's manageable for you to afford. I think part of why I was also asked to be part of this panel is how our team helps support families when they're choosing an end-of-life pathway for their family, for their child, and how difficult it is to navigate and supporting them through that process. I think there can be a lot of nuances that are really challenging with that within the pediatric setting. So often we have parents that are on different pages that don't agree with what they think is best for their child. Some who think that too much is being done, that their child is suffering on some level. Others who are feeling this is as if they can see the twinkle in their child's eye, if they have like communication with their child, if their child is included in their family and their life and can do activities, it's great. That's exactly what they want. And so I think it becomes like our role to kind of help guide families through like what their choices are, and then to be that kind of like also bridge communicator with the team of what the family's priorities are, and bringing the team and the family together to have those conversations. And I think when we're navigating end-of-life situations, it also becomes challenging with a pediatric population. It's how much do we involve the child in those conversations? There are some families who have felt strongly that they don't want to have a direct conversation with their child that they're dying. And the ethical things that can come up for some providers as they're trying to navigate how they're caring for a child who may not be able to survive their illness, and that child not having that awareness, and that maybe feeling wrong to that provider. And I think also kind of providing support for the parents to help them recognize that their child probably knows on some level, like they're present with their body, they know that they're not feeling well, and how to kind of help guide and support their child through their dying process. I think some of the things we really try to focus on with families is, where would you want your child to die? Do you want that to be in the hospital? Do you want that to be at home? And kind of help navigate whatever services are going to best meet their needs in whatever setting feels right for them. I think we're also wanting to address who they want to be there during that process. I've helped support a lot of families whose children have unfortunately died in the hospital, and some that have wanted a really large community around them and supporting them and finding space for all those people, and exceptions with like the different unit leadership to have as many people as they need to support the family. And I've also had some families want that to be an extremely private experience, and for lack of a better words, had to be kind of like the bouncer outside the door, like giving them their privacy that they needed. And then I think the other thing that we really explore with the families and the children are the activities, the experiences they want to have while they're still here, and kind of help formulate a bucket list, for lack of a better word, for them of things they want to do. And even working in the NICU, I've had parents like create beautiful kind of like experiences that they want, like all these outfits that they had picked for their child, bringing all of those in and having like a photo shoot, being able to do all those things, bringing in like the books that they had wanted to read to their child and read those to them. Some children have never been outside, so making sure that they get to experience the sun, the fresh air. Those have been some really beautiful experiences being outside. We've had great experiences with parents connecting with like our music therapy team to write lullabies about their children that they can record and keep. And we were talking a lot about like this morning with food and culture. We had like one mom who it was her like hope and wish that her child would be able to eat ice cream. That's like all she wanted for him. And he had never been able to eat anything orally for his 15 months of life. And so before he died, he got ice cream. And And just also thinking about like this morning's discussion with like food and culture, like we've had like families that it's really important they have a meal with the providers before we move forward with death. And in being really like culturally humble and approaching families about their culture and religious practices that are really important to honor before their child dies. I think a lot of times we've had experiences we have to be very mindful of the timing of their child's death. Like for instance, if they need to get to like the mosque within a certain amount of time for prayer or other things. So I guess essentially in summary, I guess as much as possible, I think it's wonderful when we can spend the time, the dedicated time to truly know our families and what's at the heart of their decisions. And I know that many of us don't have that time. And so then also finding the people on our team that like we trust and can kind of help consolidate all of those silos and bring us the information that we need so that then we're moving forward with the best plan that supports the family as a whole.
Yeah, that normalcy, like I think you talked about for your daughter, right? Her sibs and being able to go out and do things and have them jump on the bed and the normalcy that comes. And then Brittney, it's interesting to think, right, this conference has been a lot about kind of engaging systems, family behavioral health, working towards as much active, healthy, consistent lives. And then to realize there's another side to this too. And family engagement can look differently as well. I remember a father saying to me, you know, if this is my daughter's time to die, then it's my responsibility to make sure she dies with me and with my family. Not with him, but like with me in my arms. I have a responsibility as her dad. When I brought her into the life, it's my responsibility to see her out of the life as well. So powerful, that engagement side too, that I don't think a lot of people think about. Thank you. What is and to each of this, so we have a doctor, a parent, a social worker. What is the role of a doctor in family-centered care? What is the role of a parent in family-centered care? And what is the role of a social worker? Dr. Brinton.
I have a responsibility to write orders and to make sure that certain goals are met. And what I've loved that our division has been teaching me is, before that, meeting with the family saying, what are your goals? Sometimes children can't speak up, but the children can speak up. What are their goals? To make sure that what we're trying to do is really, truly what helps the child and the family have the life that they want to have and have the resources they want to have. So I think my reminder, again, that avoiding that hubris, my reminder that, whoa, put a break on it first. What are your goals? How can I help you meet the goals? What are the barriers to your goals? How can I help overcome those barriers? And then I can write those orders, and then I can proceed with that plan.
Eileen.
As a parent, for the first part, she was in a medically induced coma, so it was my goal to be there for her, to be able to be her voice. When they told us we might have to pull the plug, she might not make it. Most of them assumed she was going to pass away. So my husband was a great voice there as a parent saying, no, we're going to see this through. He was the one that talked to her and would see her move and videoed it saying, no, see, she has activity. We can't pull the plug. So as her parent for that first part, it was to be very active in all the meetings and to go and to learn and to understand. And for the second half, it was not only to explain to her what was going on so that she could understand and to support her, but also to make sure she had her voice too, and to change that role from us doing it to, okay, what can we do to help you be involved in your voice? And she now, when we go to any of her appointments, she's very vocal and it's amazing.
It's incredible. Now, I see my work and my role as being an advocate, and I interpret that in lots of different ways, whether that's advocating for change within the system for a family to get what they need, advocating for a family's voice to be heard if they're not feeling heard, advocating for them to get the resources that they need so that they truly feel like they are thriving with whatever circumstance they have. advocating for their mental health needs to be addressed and that they feel like that they're getting the emotional support that they deserve.
Yeah. Yeah.
What can you do if you feel like a family is not engaged?
The question was, what can you do if you feel like the family is not engaged?
What do you do at that point?
You know, for at least on the medical side of things, I think this is where we access our team. You know, having the bedside nurse who sees things more might be able to give us feedback on how the family slept or eaten or communicated, and having our social work team to be there to help us see those gaps that might be there to help us get that quiet time to reach them. I think sometimes families perhaps want to be involved, but there's a barrier. And trying to root out what is that barrier, how can we overcome that? And I think we need our whole team to be able to overcome those barriers or identify them.
As part of that team, we really enjoyed having a child specialist there who was able to explain to us in a way that maybe we could understand. Okay, this is what the doctor said, this is what it means. And so that was kind of a bridge for us, like, okay, now we can get involved because she's there to guide for us, for siblings, and for the patient.
I guess I would want to better understand how you define someone not being engaged. I think often I've experienced parents getting labeled as not being engaged, maybe particularly if they're not able to be at the hospital as often as people might think that they should be. And so I think a lot of times it's exploring with family, like what Jennifer was saying about like barriers that they might need to be there. I think also maybe helping the team understand like, hey, this family has 4 of their children. They're dependent on dad's income. He has to work. They've been here in the hospital for 6 months. Like they have to like be able to pay their bills and have a home to go back to. And I think also sometimes if someone's doesn't appear to be engaged, I also wonder what emotional need maybe is not being met for them. Like, is there something that's fearful for them about being in the hospital? Are they not feeling heard? Are they not feeling supported? And so I would want to have a direct conversation with the parent about what I was worried about and how can I support them.
So this is for you, Brittney. How do you take care of your own mental health? Because I couldn't imagine. After I graduated, I had to take my grandson up to primaries. He had cut his head. And my daughter was she was going crazy. And when we got up there, a little boy was being life flighted and his grandpa ran over him with the mowing lawnmower.
Yeah.
And it's still, I don't know how you do it. Thank you for being there for the families at a time that they need you so badly. So how do you take care of yourself?
That is sometimes easier than others. And I definitely have to like ramp up my self-care more at times. I feel like I'm really, really fortunate right now. I am part of an amazingly incredible supportive team of professionals that are doing this work like side by side with me. And so I can like debrief or lean on them for anything, or if something's feeling too much for me at the moment, I can tag out and they'll pick up my weight until I can step back in. I feel like I have to be really mindful of meeting my needs. Like when I'm not in the hospital, sleep's a big thing for me. So I have to really try to work on getting good sleep, physical activity, time with my family. And then I'm also someone that needs alone time to recharge. Sometimes the hospital is a very overstimulating environment. There's a lot going on. And I'm fortunate my husband's very supportive. And if I need time for myself, he'll take the kids and they'll disappear and I'll have just my quiet time. So that's what I do.
But I would like to extend that question to the other two. Like, Eileen, what do you do? I mean, you've got a full...
It was hard at the beginning because we got released the day COVID shut everything down. And so we had a plan. I have so much family. I'm like, they're going to come. We're going to do this together. And I was like, oh, and not. And so my husband is very supportive. So once a year, I get out with a group of women and we go on a retreat. We just go. And then another time I might take a week with my mom and we might just head out. We're just going to go window shop for a week and sit inside and play games. I read a lot of books and do a lot of puzzles. And my husband knows when I'm focused on something that something might be on my mind, or I just need to just do it. And so my kids will tell you at one moment, all I ever do is puzzles, but I might only ever read, and I might only ever clean, and I might only ever go outside. And so just that balance of finding that support system was big for me. We had a great school support system, a great Ronald McDonald House system that gave us the care. And just coming here this weekend, it's like, hey, what can we do for you? I'm like, oh, this is really nice. I should leave the kids more often. And so just finding that self-care, like you were saying, just sometimes you have to be on your own. Sometimes that stimulation is a lot. And sometimes just having that family support, because when you have a quad, it's a lot of lifting and a lot of heavy work and a lot of driving. And I'm very, very blessed to have really good family and friends that will come with me and support me in that way. And that's how I can push through.
I think that, again, that team and that family approach is so important. And I think part of it too, in my hard times, when I realize how much I am supported by my team, it helps me remember in my not hard times, I need to make sure I'm putting myself out there to support my team, to watch for their symptoms of maybe needing to reach out but not daring to make it safe for them to be able to reach out to me, to stand up for them when I see that things are, just trying to be there for my team too, because that is so valuable, that two-way street with it. And that's something we all have the power to do. It's just sometimes it's a little embarrassing sometimes to go to somebody, hey, how are you doing? It's been a kind of a hard day. Can we go on a walk? Can we, just trying to break down those barriers. I tend to be really shy, but I'm trying to do more of reaching out and really trying to make sure people are safe with me so that they can get that support just like they give to me.
And another key part of that, I think, too, is recognizing your own red flags, so to speak, your own, hey, my patience is thin. I'm not, this isn't typical for me. This isn't usual for me. Or I'm frustrated easily, or I'm noticing I'm a whole lot tireder lately than I have been. I've got to recognize and take a step back or make plans to care for myself too. Yeah, great question.
I am early on in my career working with Dr. Brinton as a complex care physician and have been humbled just in the few years that I have been doing this by how often parents are correct and medical professionals are incorrect, and have started leaning more and more into if I'm stumped, just telling the family, I don't know, what do you think it is? And so far, I have not been wrong with that. So I'm curious from parents' perspectives. And frankly, I'm not interested in a humble answer on this. I want a real answer. How often has your spidey sense, your parent's spidey sense, or your parent gut been right?
I don't know. It's such a hard one because we work with such a great team of doctors that we've been able to bounce back and forth. But I am so grateful that my husband was right when the doctor said, you're going to have to consider pulling the plug. She's not going to make it. And he said no. The fact that he was right is one of the things I'm the most grateful for, because what would we have done without her now? And so I'm so grateful that I lean towards my husband that way. And to try to be more outgoing, I tend to be more shy and, let's talk this out. And I love to learn. We're both teachers by nature. And so it's dig into that education. But he often reminds me that it's okay to be that voice. So I don't know how to really answer that because I'm not always right. But I'm so grateful that I have a husband that is.
Janae's got an answer.
This will be my non-humble answer, but to be honest, I want to say from my intuition, I spent a lot of time with my child. This is my people up here. We were part of the comprehensive care clinic his entire life, Rainbow Kids. So I think partnering with them and having the relationship with them that I learned as I was raising him up to the day he passed away, my spidey senses were right. So I don't want to cry, but I think that's the one thing that I'm sitting here looking at Dr. Brinton. I'm I can't count how many times I've talked to her and I've never seen a face. So, but all of them leaning in and saying, what do you feel? Or how do you think this is going? And being genuine with it. And I think that's the piece, is you can tell when somebody is authentically connected to you versus I'm checking this box today because they're telling me to go check on you. And Orly sitting in my room for hours trying to convince me to leave the room. Like, just go for a walk or go get some food. And it's in those moments as a parent that you're like, oh, these people care about me and my well-being, and that we're not just here getting treated, they're a part of your family. So I think more often than not, parents want to believe and trust in the providers, and they want to respect their expertise. But inside, we've taught ourselves to not believe what we're feeling, and it's been shut down for so long that you're always questioning yourself. And so the more that you can give them that opportunity, I think the better outcomes we have and the better relationships we have.
And I think I would add, too, in my experience, ambiguity in a parent is such a huge part of that process, right? 1 second, this looks like the right thing, and then it can just change in a minute and be like, well, no, maybe it's this, I don't know. And we've been a believer, and I think Brittney could attest to this as well, that it'll become clear to you. You'll know. How many families, like with you and your husband, that example of like, I don't know. I don't think this is his or her time. This doesn't feel like it. There's still some things. And then eventually there comes a point where they're like, this is different. And I think we need to have a different conversation. And how do we do that? Like, they know. And we've been one of the founding themes of Rainbow Kids a lot of times was listen to the parents, believe the parents, get their input on that. And parents in here, I think you could all agree, you know your child probably better than most. Like, see that eyebrow raising right there? That's telling me he's mad. He doesn't like that. Or, hey, see that arm moving right there? That means she wants the TV channel changed. Hang on, let's get that done. It's huge. Yeah, but you were going to say something else. Sorry, it sounded like.
I just had a follow-up question on that. Again, for all of the parents here, and this is so helpful, and huge thank you for sharing your experiences. We have the chance to work with medical students and residents and people who are even earlier career than I am. Do you have any suggestions or things that you wish that people were learning, like right from the starting gate, so that as opposed to it being like, hey, this is a really bad experience that we had, so like you guys are learning it down the road, something that like we can start off professionals on the best foot to have that humility and like ask those questions? Or I guess if anyone else has.
I love that question. I think one of the things that I love when they're just starting is to have them talk to the patient first. If they're awake, if they're able to talk, I do it the most. When they start talking to me, I look at my daughter and I ask her for the answer. They're like, oh yeah, she's old enough now. So a lot of the times just telling them, talk to the patient first, get to know her brother and sister, because her brother and sister are struggling too. They're tighter than me as a parent. Like, I walk in the room and we're trying to hang out and be funny, but I am not nearly as funny as her brother. They have a different relationship. And if a medical professional can know that, they can draw that side out of them and say, hey, how's your brother doing? Or how's this going? Or how's your artwork doing? Like, if they know them, then the care becomes so much more. One of my favorite doctors, we couldn't get a shot into her. They were trying to pull blood, and he was like, I'll go get you some Skittles. And she was like, done. He was the only one that could get that needle in her because she was so terrified, but he knew her just well enough. And he did. Within 5 minutes, he was down and back up.
Any other, don't dismiss a parent's concern, right? There's always a reason. I listen to that question and I think, I remember there were so many times in an ICU where they'll say, hey, we want to introduce this medication, and a parent will be like, nope, next. And they'd say, but this medication can do A, B, and C, and they're like, I don't care, next, bye, nope. And then outside of the room in the offices and stuff, they're like, we're not explaining it right. They don't understand it. They don't get it. This is just the thing. What is the problem? Family's being difficult. But then you go in and you sit with that family and you talk to them like, hey, what is it? What is it about this med? And they go, my mom was in the hospital and they started her on that medication and she died 3 days later. I'm not doing that medication. No way. But nobody took the time to just say, hey, what is it about that? What is it that worries you about that? Right? It was just I don't know what to do. They're just not, they're not paying attention. They don't care. I don't know what it is. Right? But when you talk to them and you go, oh, okay. So what was mom's diagnosis? What was she? Okay, here's some of the differences. Here's how this is. And you're in the ICU and you'll be, right, you can be watched and do different things. But sometimes I've seen so many times a concern or something's just dismissed out of hand instead of saying, well, let's talk about that. What is that? What's the resistance here? Why is that? We would say, if you act like you have all day, it could only take 5 minutes. But if you act like you only have 5 minutes, it's going to take all day, right? So that Dr. Ferguson talked about active listening, and that's part of that is just being attentive to what's happening. It's the panelists. Thoughts?
No, I would agree. Like always approaching those conversations with curiosity and tell me more until you can reach an understanding.
Yeah, and being vocal about that, right? Like, I'm trying to make sense. Help me understand. What is it about this? Yeah.
I think like you said too, oh, so sorry.
Go ahead.
Just asking families what their perception is. Like what do you see when we're talking about this? What are you seeing from this? How does this make sense to you? What are you hearing from what we're saying? What's the picture you're getting from this? Just to see where their insights are and also where some misunderstandings may be that we can overcome.
Yeah. Or they want to recommend this treatment, and that means 3 more clinic visits a week. That means that means this many more side effects. That means that, right? Like I'm already, what else? I can't. How do I do it? Yeah, Janine.
Checking your biases and your judgments, because a lot of the times it's about a goal, and some of our children don't have long-term goals, right? So they're short-term, and so that one medication means 5 more additional things to worry about. And it's not that I don't want to do those things, it's that I'm physically and mentally burnt out. I think Rebecca checked on this or spoke on this a little bit earlier, but when you're a caregiver, you don't get to go home. That is your home. And so you can have all the community around you possible, but you still burn out. And you still have to take that into consideration when you're making medical decisions for children that are very challenging, but you love desperately. So I think it's just checking the bias and your judgments and then asking if it's part of their goal. Like, what is their goal, and connecting it back to what their goals are.
Sorry, it's me again. I work for Ronald McDonald House Charities, but I'm also a cancer mom. And I love the question that you asked, and I love that you are able to be upfront with parents to say, I don't know. I think that's really, really hard for professionals to do. And as a parent, I can tell you that it would be so, I would just appreciate that so much. I would say something that I would love, that I want all healthcare professionals to learn is the need for direct communication. I loved that what Dr. Ferguson said about how you can be transparent and you can also reassure. Those 2 things can go hand in hand. I think a lot of times healthcare professionals, it's hard, right? It's hard to have hard conversations, but that you can have like when you're about to have a hard conversation, the need to be direct and say exactly what's going on so that parent feels like they have all the information. Sometimes healthcare professionals feel like they're doing the parent a favor by glossing over the hard stuff and painting it in a prettier way than the doctors who actually see the writing on the wall don't really feel that way, but they want to gloss it over so that the parent, because they don't want to make the parent uncomfortable or sad, right? But it's actually very empowering for the parent to have that doctor give them sad information in a direct way and sit with them in it. So.
I don't say this a lot, but amen. Yeah, I don't know if any of you have ever had the experience as a child, if you walk into a room where adults are crying or struggling or something, and they immediately just shut down and quiet because you're the child that comes in. And as the kid, you're like, what? Right? And there's this, don't worry about it. I mean, it's the same thing, right? Like doctors come in and it's like, what's going on? There's something you're not telling me. What is it? Why won't you just tell me? What are you worried about? Talk to me. Yeah. Yes, there's a...
Your question is like encouraging me to speak up because I've been thinking about this a lot this whole day. Of like, what can we do as providers? We can send nurses, the ones that are like the face with all of these parents, to conferences like this to remind us nurses of, like my nurse friend here in front of me, of like our why, like to re-inspire us to hear back from parents about what they're going through. Because sometimes when you're on the front line and you're just giving multiple shots and you're feeling like, heck, like, am I making an impact? Am I making a difference? You know, I'm getting burnt out, all of these things. Coming to places like this and having hospital administration support bedside nurses, I'm not talking nurse managers, I'm talking bedside nurses coming to a situation like this to say like, oh my gosh, look at all of these parents that I have taken care of someone similar to them, and I'm hearing them and I'm feeling inspired by being around them. And it reminds me of my why I'm a nurse. It reminds me of why I want to show up with like compassion and empathy and like treat every patient like they're, oh, I'm so emotional today, you guys. But why, like, it reminds me to like make sure that I remember my why of why I do the work that I do and why I take pride in what I do. So I feel like that's something that we can do as, like healthcare providers and things like that, is like send people to these things where like they're gonna hear and they're gonna be inspired. So yeah, that's my shameless plug.
Thank you.
Just something to kind of quickly add to that. When it comes to like caring for a family member, it's always really difficult, and you always have a lot of decisions you have to make. And one of the things that helps with that is the stream of information that you receive from your healthcare team is really important. And also being able to follow up on that information. I can't count how many times I've had to ask a nurse, hey, what's this medication going to do? How is this going to affect their care? And then they'll say, hey, we'll follow back up with you the following day. And that either never happens or I get the same update like 7 times. And so I think that like that's one of those things where it's in the notes, we know what's in the notes, but there's no follow-up to that note to say, hey, we've followed up with this patient, we have let them know what's going on. Or the other side of that is no one's talked to this about them yet, we're waiting to hear back for more information. That's totally fine too. If you guys don't know, that's fine. I'd rather wait for an answer than have kind of a half answer, if that makes any sense.
Hi, everybody. My name is Christina. I'm with RMHC, the Houston chapter. And I just want to encourage everyone, healthcare professionals, social workers, nurses. If the Ronald McDonald House has a social worker, you can always talk to your families and say, hey, have you reached out to the social worker at RMH? Because a lot of times we are sounding boards. We don't want any additional information from the families, just for them to have a place to call home, and they can come and talk to us about anything, anytime. The majority of us will, at our house, we are 10-hour shifts. So between 10 and 7, the door is always open. Families are first. If we are eating stops, and we help the family walk through whatever process that they need to walk through. A lot of times families come in and say, hey, I don't think the treatment plan is going well, and I'm nervous to speak to the medical team because they're professionals and they know. And so we encourage the family, hey, that's your baby, that's your kid, you are their voice. If you have to advocate, if you have to call patient services, or if you have to get the charge nurse, if you have to pull on a coattail for someone to listen to you, absolutely do it. We encourage families to do that almost on a daily basis. And so if you have an RMH and your families, utilize us as a resource. I think I speak for everyone. We're always available for the families. We love what we do, and we're here to serve and to be a support for the families, not only the patient. We love them as much as we do, but for the families in total. So use us as a resource.
And I would agree, Maria is a fantastic social worker and resource at Ronald McDonald House here. And being someone that I've worked closely with in the past, I'm really grateful that she's there for the families staying at the house.
Thank you.
I just want to say, I take away just a summary of today. And I think what really resonated with me is it takes a village, right? It takes a village. I really appreciated what Dr. Ferguson said. Look, a doctor might have 15 minutes because that's what they have. I mean, there are certain things that it may not be fair, it may not be right, but there are systems and there's efficiencies and things. And so because one person can't do it all, that's why we have to work in teams. The physicians have to be with their team, the nurses, the social workers, the care managers. Everybody has to, with their administration, everybody has to be noticing and observing. And where one person doesn't have the time or the information, that's when we look to the next person and say, okay, I don't know this answer, but this family's got this question, or here's an issue that's come up. Here's a shortcoming. Here's a gap for this family. What do we do about this? It's a matter of paying attention and watching and listening and learning so that we then become the voice for the family or with the family. And then we look at also our community resources and say, okay, there's only so much we can do within the hospital, but what are we gonna do because this family's not gonna be here all the time in the hospital. Hopefully the day is gonna come that they're gonna take their child and go home and they're gonna live out in that big world outside of the hospital. So how are we going to help them to have the services and the supports and the backup that they need so that they can feel confident that they can go out there and do that. So I think that was my big takeaway from today is watching, observing, listening, learning from families, and then as we all work together, helping families, saying, this is what I can do, this is where my time is, this is where my skills and my resources are, and I don't have those skills or that information, but guess what, we're gonna work with somebody that can get that. So building the networks, and I think today is a day for us to say, here's our opportunity to talk and build those networks. What can we do to build those networks? Because that's really what it takes. We can't rely on one person, one doctor, one hospital. It takes everybody. It takes the parent's voice, it takes the patient's voice, and it takes us, it takes the experts to pull all of our information together and just kind of be a think tank, a brain think tank, and say, okay, here's the gaps, what do we do? We can fix this, how do we do it? We have to work together. So, great conference, thanks for all the speakers, everybody was great today.
Yeah.
And the parents as well.
Yeah, so network amongst each other, share numbers, Jeff. People get with people, do it. And I want to echo what Brittney said as well. Maria was a leader in social work at Primary Children's for many years. And so she was someone that both Brittney and I both respected and worked with closely. And so amazing resource for Ronald McDonald House too, to have at this time. Okay, I want to thank our panelists, Brittney, Eileen, Dr. Brinton, thank you.